In 2026, many seniors are hearing the word hantavirus more often, and for good reason. It is not the most common virus in the world, and it is not something that should make people panic every day. But it is a virus that deserves serious attention, especially for adults over 60. The reason is simple. When hantavirus becomes severe, it can affect the lungs, the heart, the kidneys, and the body's ability to recover from a sudden infection. Hantavirus is mainly linked to rodents, especially infected mice and rats. People can become exposed when they breathe in tiny particles from rodent urine, droppings, saliva, or nesting materials. This can happen when someone cleans an old garage, opens a storage room, sweeps a dusty shed, enters a cabin that has been closed for months, or moves boxes in a place where rodents have been hiding. The danger is that the virus may be present even when the area looks only slightly dirty. A few droppings in a corner may be enough to create risk if they are disturbed the wrong way. For seniors, this matters because the body does not always respond to infections the same way it did at age 30 or 40. After 60, the immune system may react more slowly. The lungs may have less reserve. The heart may already be working harder because of high blood pressure, coronary disease, diabetes, or other chronic conditions. Some seniors also take medications that can affect hydration, blood pressure, kidney function, or immune response. So when a serious infection appears, the body may have less room for error. One of the most dangerous things about hantavirus is that the early symptoms can look very ordinary. At first, a person may feel tired, feverish, weak, or achy. They may have chills, headache, dizziness, nausea, vomiting, diarrhea, or stomach pain. Many people would assume it is the flu, food poisoning, exhaustion, or a normal seasonal virus. A senior might say, "I just need to rest." But with hantavirus, waiting too long can be risky if breathing symptoms start to appear. The warning sign that should never be ignored is difficulty breathing. If someone develops shortness of breath, chest tightness, coughing, unusual weakness, or a feeling that they cannot get enough air after possible rodent exposure, this is not the time to guess. Medical help is needed quickly. Hantavirus can progress to a severe lung condition where fluid builds up in the lungs and oxygen levels drop. This can happen faster than people expect, and early supportive care can make a major difference. According to the CDC and WHO, there is no specific cure that simply eliminates hantavirus, so treatment focuses on urgent supportive medical care and managing complications early. This is why seniors must stay extremely alert in 2026, not afraid, but alert. Alert when cleaning old spaces. Alert when seeing rodent droppings. Alert when returning to a cabin, farmhouse, basement, attic, or garage that has not been used for a long time. Alert when unexplained flu-like symptoms appear after possible exposure. Many serious cases begin with a simple mistake, such as sweeping dry droppings, vacuuming contaminated dust, or touching surfaces without gloves. The safest approach is prevention. The CDC advises people to avoid contact with rodent urine, droppings, saliva, and nesting materials, and to seal holes and gaps where rodents may enter the home, garage, workplace, or campsite. Food should be stored in sealed containers, garbage should be covered, and clutter should be reduced because rodents love hidden spaces. If a senior or caregiver finds rodent droppings, the first reaction should not be to sweep. Dry sweeping can push dangerous particles into the air. The area should be ventilated first, and the droppings should be sprayed with disinfectant before being wiped carefully. Gloves should be used, and hands should be washed very well afterward. If the contamination is heavy, it may be safer to call professionals instead of trying to handle it alone. Another reason seniors must stay alert is that many older adults spend time in places where rodent exposure can happen without much warning. Some enjoy gardening. Some keep tools in sheds. Some live in rural areas. Some visit family cabins. Some store old clothes, holiday decorations, newspapers, or boxes in garages and basements. These are normal activities, but they can become risky when rodents have been present. It is also important to understand that hantavirus is usually not spread like the common cold. Most hantavirus infections come from contact with infected rodents or contaminated materials. However, health authorities have noted that one specific type, Andes virus, can rarely spread between people through close contact in certain outbreaks. WHO has described hantavirus as rare but severe and has assessed the global public risk from the 2026 multi-country cluster as low, while continuing to monitor the situation. For the average senior watching this video, the message is not to fear every person or every public place. The message is to respect rodent exposure. If you see signs of mice or rats, take it seriously. If you clean an old dusty area, protect yourself. If you feel sick after possible exposure, tell your doctor clearly. Do not simply say, "I have the flu." Say, "I may have been exposed to rodent droppings." That one detail can help doctors think about the right diagnosis faster. Caregivers should also pay attention. Sometimes seniors minimize symptoms because they do not want to worry their family. They may say they are just tired, or they may avoid going to the doctor. But sudden fever, deep muscle aches, unusual weakness, stomach symptoms, and especially breathing difficulty after possible rodent exposure should be taken seriously. The most important lesson is this: hantavirus is rare, but it is not harmless. For seniors, the risk is not only the virus itself, but the speed at which a mild-looking illness can become serious. A small exposure in a garage or shed can become a medical emergency if symptoms are ignored. So before cleaning a basement, opening a shed, moving old boxes, or entering a closed cabin, pause for a moment. Look for droppings. Look for nesting materials. Look for chewed packaging. Ventilate the area. Do not sweep dry dust. Use disinfectant. Wear gloves. Protect your breathing. And when in doubt, get help. If you are over 60, or if you care for someone who is, remember this simple rule: hantavirus does not always give a loud warning at the beginning. It may start like a simple flu, but the danger can grow quickly when the lungs become involved. Share this video with someone who has a garage, basement, shed, cabin, or storage room, and tell me in the comments, have you ever found signs of mice or rats in your home or workplace? Your answer may help another senior take this risk more seriously before it is too late.